I remember when I was in Jamaica, and prior to me moving to the States here, I was in the department, and there were a lot of persons who were signing up for this recruitment company. And so I went ahead and signed up because I was like, if the ship is sinking, I'm going to sink with them. But I'm not going to be in a department that everybody is migrating overseas for a better opportunity. And I didn't take the opportunity because I feel as though I wasn't following them. You understand? I want to stand out a little bit. So I just kind of take myself away from the entire situation and didn't apply. So what I did at that time was to go ahead and apply with everybody else. Because I say, if 30 persons are going overseas, I want to be amongst the 30 persons. And so that's how I ended up here in the States today, because I took that risk. And the same thing when you're in a practice. If you're a new nurse, if you're a new nurse practitioner, you realize that sometimes you're going to a practice, and especially if it's a setting where you are not, in like a room together, a clinic together, sometimes you tend to find yourself doing things because you hear that, oh, the other persons in the practice are doing it, and it is not always correct. Because even though, yes, everybody in the department in Jamaica where I was at the time was signing up for this recruiting company, and eventually almost the entire department left with the recruiting company to the States for better opportunity. Even though that worked out well, the situation that I'm using here now with my nurse practitioner program or my nurse practitioner job, it doesn't apply to that situation, because sometimes if you don't have somebody that is talking to you, interacting with you on certain level regarding certain things that are happening, you might find yourself doing things because everybody else is doing it and they don't know what the correct thing is. It's always good to go ahead and make sure you find resources that are going to help you to answer those questions in situations like these. I was in a clinical setting where all the other providers or nurses were there. I would be able to ask them questions and we can rationalize certain things. But without that there, it takes a little while for you to understand, say for example, how to do certain things as a nurse practitioner and what the expectations are. And that was just a situation for me. It took me a little while before I get to finding out that certain things that I was doing as a nurse practitioner is not the correct thing to be doing, even though it is said that the practice is doing it or other nurse practitioners are doing it. So not because everybody else is doing it, means it's correct. You understand? So it's always good to go ahead and find resources. Whether or not you're going to go on Facebook, you're going to go on LinkedIn, you're going to go on TikTok, Instagram, Lemon platforms, and try to interact with persons who are a part of the area of study that you're in, the profession that you're in. So if you're a nurse practitioner, find different groups that are, for nurse practitioners. That way, if you have any questions, you can always go ahead and ask persons. And so you will be able to get answers at that time because of you interacting with other persons who have had experience and they're able to guide you. And I always tell people you're never too old to learn, because even if, say for example, I'm doing this thing for 10 years, other persons might be doing it for 6 months and they still have information that will benefit you in your, in your practice. It might not be something that you think is significant, but it is something that can take into consideration. So always be open and willing to hear what other persons are saying. And it's the same thing here. I drop my question because I feel as though I want to hear from other persons what their thoughts are on a topic. So that way it can give me a better insight, so that way I don't feel as though I'm just one-sided or narrow-minded in my thinking. I want to hear what the overall general, public is thinking about my decision or what a person would do in a situation like this. And it's not only to help me, but it's also to help other persons out there, because a lot of us are going in these jobs and we don't know what we're going into. You understand? We just know that they say, oh, we have this position available and this is what we're offering in terms of pay. And sometimes the pay can look nice to the point where you forget about what you were trained in school, what you were taught in school, just because of money. And so you make the wrong decision and realize that later on you were doing something that is unethical, cost your license. So definitely use these words of encouragement or use these, videos not only for entertainment's sake. Sometimes when persons do post their videos, use them as educational, use them for information, as a source of resource to help you as you go along in your journey as a nurse, a doctor, whatever area of study or whatever field persons are presenting topics on or situations on. Use it as a guide to help you so you cannot make the same mistakes that other persons have done in the past. All right, but I do thank you guys so much for the comments and for liking the video, watching the video, and I do hope that you will continue to just check out the channel here and follow me Follow me on TikTok here, Think Nursing One, and subscribe to my YouTube page at Think Nursing, where I share longer content and just additional information that you can always be a part of in terms of, interaction. And also, I will have my podcast there where I'll interact with other nurses. So definitely feel free to go ahead and subscribe on YouTube at Think Nursing. Until then, I will see you in the next video. Bye.